Vanakkam, good morning. In this video, we are going to discuss about the spinal cord controlled in the posture and movements. The spinal cord control in the posture and movements. For demonstrate the importance of the spinal cord and posture movement, we have to make the spinal preparations. So we have to make the lesion at the upper part of the spinal cord, usually in the experimental animal like cat and dog, at the level of the below the level of the C5 cervical cord, C5 level, because the below the C5 level cardiorespiratory systems are intact. Otherwise, if you make the lesion above the level of the C5 level, the cardiorespiratory arrest will come, so animal immediately die. So prevent this, we make the lesion below the C5 level. Animal after the section of the upper part of the spinal cord is spinal animal. We cannot demonstrate in the human being experimentally, but we can see the features of the importance of the spinal cord in the spinal cord injury patients in the hospitals. Mostly spinal cord injury occur during the road traffic accidents. We can see the features of the spinal cord injury in the intensive care units and emergency care units. Immediately after the spinal cord lesions, the animal or a human being enter into the stage of the spinal shock. Features of the spinal shock are areflexia. All the reflexes is lost. That is called as the areflexia. All the sensation lost. That is called as the anesthesia. Paralysis of the muscles seen. So all the muscles paralyzed. Atonia, below the level of the lesion, tone is lost. That is called as the atonia. BP is crassly reduced. Hypotension is most common seen in the features of the spinal shock. It is due to the cessation of the tonic bombardment of the spinal motor neuron by the upper motor neuron lesions, because the supraspinal control is lost because of the we make the lesion above the level of the spinal cord. So in the higher centers, brains, medulla, pontine, this control over the spinal cord is lost. So it produces the features of the spinal shock like areflexia, anesthesia, paralysis of the muscles, atonia, fall in blood pressure. The stages of the spinal shock in the animals, it takes 2 to 4 hours, but in the human beings it will take 2 to 4 weeks. So after the stage of the spinal shock, when we give the proper treatment, proper nutrition, the stage of recovery will come. The stage of recovery due to the axonal sprouting, the axonal regeneration is the important reason for the stage of recovery. First, the sphincter muscles, sphincter of the urinary bladders are tone is recovered. Tone of the blood vessels is recovered. The reflexes not only recovered, exaggerated during the recovery stage, and muscle tone also recover gradually. It increases. Hypertonia, Moss reflex, that is the reactivation reflex. It is when scratching the lower abdominal wall, inner aspect of the thigh, it produces the evacuation of the bladder and bowel, and flexor spasmum at the lower extremities, profuse sweating seen in the Moss reflex. So in the spinal cord patients, they are admitted in the hospitals for the defecation reflex or micturations Suppose the patient வந்து ஹாஸ்பிட்டலில் அட்மிட் ஆகிருக்கும் போது they can the bowel movements and bladder movements is done by the creating the Morse reflex. You scratch the lower abdominal wall, inner aspect of the thigh, it will evacuate the bladder and bowel. It's mainly due to the flexor spasm of the lower extremities and profuse sweating. In the micturition reflex, hyperactive. So due to the hyperactive micturition reflex, the hypertrophy and fibrosis of the bladder wall is occur. It decreases the bladder capacity. That bladder is called as the spastic neurogenic bladder occur in the spinal lesion. And the defecation reflex is written but never complete. It cannot evacuate all the wasted bowel content. So defecation reflex returns not never complete. During the stage of the recovery of the spinal injury, blood pressure is normal at rest, fluctuate during the different conditions. We can see the supporting reactions in the spinal animals during the recovery stage, not in the human being. In the spinal animal we can see the supporting reactions. It is indicate the locomotor generators is located in the spinal cord. In the positive supporting reactions, when the feet of the animal is touched then withdrawn, the lower limb difficultly follows the examiner finger. This is happens like metal is following the magnets. So this is the positive supporting reaction. In the positive supporting reaction, in the experimental animal, lower limb becomes rigid like pillar. Animal can stand and walk for the 2 minutes. This reflex supports the animal to stand. This indicates the generator for the basic pattern of the locomotion is located in the spinal cord. It needs appropriate stimulation to activate the spinal motor neuron. So the positive supporting reactions indicate the generator for the basic pattern of the locomotion is located in the negative supporting reactions. After 1 to 2 minutes of the positive supporting reactions, the tone of the muscles in the lower limb disappears. So after the positive supporting reactions, 1 to 2 minutes, the tone of the muscles in the lower limb disappears. So animal cannot stand and walk more than 2 minutes. That is negative supporting reaction. So in the stage of the failure in the spinal cord injury, it occurs due to the improper medical nutritional support. During the stage of the shock and stage of the recovery, it enter into the stage of the failure. If you give the proper medical treatment, nutritional support, patient is recovered to the normal stage. Improper medical nutritional support, it entered into the stage of failure. All the reflexes lost. It produces the decubitus ulcers. Decubitus ulcers means bed sores. When the patient is lying in the bed, the ulcer is occurring in the defending part of the body, mainly sacral regions, back of the shoulder, everything. It produces the ulcer, decubitus ulcer. The patient is died due to the septicemia, systemic inflammatory reactions to the severe infection. That is called as the septicemia. So in the infection spread all over the body, so it produces septicemia. We have to give the higher antibiotic, otherwise it produces the septicemia. The patient died due to the severe infection. In this stage, the immunity is decreased very much, and the protein depletion is occur in the stage of failure. So these are the 3 stages of the spinal cord injury: stage of the spinal shock, stage of recovery, and stage of failure. So the importance of the spinal preparation demonstrate the generator for the locomotion is located in the spinal cord. The basic movements like walking is mainly depend on the spinal cord. So it is integrate the spinal reflexes, various spinal reflexes, and the micturition, defecation, sexual activities, everything is depend on the spinal cord intactness. Otherwise, it produces the difficulty in maturation, difficulty in defecation, and difficulty in the sexual activities. Thank you for watching this video. If you like this video, press the like button and share your friends. Those who are not subscribed this channel, please subscribe. These videos are briefly discuss the physiology topics. You must read the physiology textbooks. Thank you once again.